Hello, dear students. Now we'll be learning today is a silicate cement, which is earliest tooth-colored direct restorative material and it is invented in the beginning of the 20th century, and it is highly acidic, but it is a cement which contains the fluoride in it. This is the first cement which is introduced as a fluoride in it, but because of the acidity of this cement, this new material is rarely used nowadays because of the introduction of the newer and better material, that is the glass enamel cement and the composite resin. So we'll see this under this different head. So it is an first cement which had a fluoride in it. It is highly acidic even after a month. High degree of solubility in the oral cavity. It is a tooth colored. It is specification number, old one was 9 and it is 96 new one. So reaction wise, it's an acid base reaction cement. It is a tooth colored cement mechanically adhering to the tooth, and it is highly acidic to the pulp. It is available in powder and liquid in separate bottles. So we have seen this pictorial. We are following this picture to remember the composition of the 5 different cement, the main ingredients. So here it is a fluoride containing aluminum silicate glass with a phosphoric acid in the liquid to give you a silicate cement. So let us come to the composition of the powder. It is a silica, the main ingredient, giving a strength and translucency to the cement. Alumina 30% to react with the phosphoric acid. Sodium phosphate, potassium phosphate, calcium oxide, which is providing you aluminum, calcium, potassium ions to form a matrix. The fluoride acts as a flux, and it decreases the melting and treating temperature during the manufacturing, and it is also providing anti-corrosive property. The liquid component mainly it is phosphoric acid. Then you have aluminum phosphate, zinc phosphate, which controls the setting time, and water, that is the second major ingredient, which controls the pH and setting time. The manufacturing of the powder in the process is the fritting process. Now here all the ingredients of the powder, they are fused together at approximately 1400 degrees Celsius, which forms an acid soluble glass. Now in the composition of the powder, we have seen the fluoride salts are there. So these fluoride salts, they melt at a low temperature as compared to means it is melt just before the 1400 degrees Celsius, and this helps in dissolving the other ingredients. So this is acting as an flux. So it is the fluoride salts are also known as ceramics flux. Now after this, the aluminum phosphate, it also acts as flux and it provides you additional aluminum to the glass. After this fusion of all the powder increments, it is quenched in a water, and because of the quenching, the micro cracks are produced in the solid mass, which looks like this. And after this quenching, after this such micro cracks, you can see in the solid mass very nicely in the picture. Now what will be happen after this? It helps in grinding these cracks. They helps in grinding of the material into the fine powders. So this process is known as the fritting process. So you just remember the manufacturing process of silicate cement. Now let us see the setting reaction. The setting reaction is acid-base reaction cement, and water is essential for the reaction. The hydrogen ion, it penetrates the outer layer of the glass particles, you can see in the picture, and it displaces the different ions, that is sodium ion, aluminum ion, sodium ions, fluoride ions, and the calcium. After this, what will left is the residual glass particle, which is surrounded by the hydrated silica gel. Now these cations which are diffuses out, it combines with the phosphoric acid and it will give you precipitates of phosphates and fluoride. So this is the reaction that you can write when the question is asked on this. So just revising the reaction, when the powder and liquids are mixed, the hydrogen ion attacks the glass powder and it displaces the different cations. This degradation of the glass network forms a hydrated silica gel around the powder particles, and these liberated ions combines with the H2PO3 ion, that is the phosphoric ions, and subsequently precipitated as phosphates and fluoride. As the pH rises, this reaction causes the cement to set. So the structure of set cement will be, it is all are the unreacted glass particles surrounded by a silica gel, and the matrix is form of insoluble fluorides and the phosphates. The fluoride is in the restoration, which is giving you anti-corrosive property. The approximate setting of this cement is 3 to 5 minutes. Now manipulation, the instrument required for this is a thick glass slab and a agate spatula or a plastic spatula. The agate spatula is nothing but a spatula which is made from the stone. The reason to mix this silicate cement not to with a stainless steel spatula is because the silica particles which is present in the powder can abrade the stainless steel and it can give discoloration to the set cement. So either a plastic spatula or agate spatula are used. Most commonly we use a plastic spatula. The ratio is 4:1. Now the manipulation, the powder is dispensed and the two increments are made. The liquid is dispensed. The powder is added to the liquid and mixing is carried out by the folding method. The mixing is done till a smooth and homogeneous glossy surface mix is obtained. The mixing time is around 45 seconds to 1 minute. Now, what are the factors that affect the setting? Yes, we have a habit to write it under the control of manufacturer and under the control of the operator. So, under the control of manufacturer, it is the particle size. Finer the particle size, fast the cement set. Under the control of operator, the powder liquid ratio, more the powder liquid ratio, faster the cement will mix. Cool the glass, it will longer the setting time. The mixing time, if it is increased, the setting time will be decreased. Coming to the properties of the silicate cement, the first important property, that is the biological property, which effect you will see on the pulp. So the silicate cement, they are highly irritant to the pulp. If it is in terms of pulpal response, if it is classified, so it is classified as a severely irritant to the pulp. And this is mainly due to the presence of phosphoric acid, which penetrates through the dentine. If the thickness of remaining dentate thickness is 1 mm or less than 1.5 mm, sometimes it may cause pulpal hyperemia and also the pulp necrosis. At the end of the initially, the pH is very strong, that is 2.8, and after that, at the end of 1 hour, it is around 3.7. So if you are using silicate cement, which is very near to the dentinal pulp, you will have to give a base of calcium hydroxide or apply a cavity varnish. You cannot use zinc oxide eugenol because the eugenol which is penetrated through the dentinal tubules may discolor the silicate cement. Now let us come to the important property, that is the anti-kerogenic property, and this is due to the presence of the fluoride and the release of the fluoride throughout the restoration. So as we have seen that the silicate cement is quite soluble in the oral fluids, so it releases the fluoride ions from the restoration. So how it is giving you anticholinergic property by, I will explain it under the two mechanism, that is a physiochemical mechanism and second is a biological mechanism. Now in this physiochemical mechanism, the fluoride which are released during the setting and it is continuously releasing through the restoration. So it is taken up by the adjacent tooth. So because of this, the adjacent tooth it forms fluoroapatite crystals, means it is absorbed by the enamel. So the enamel contains the hydroxyapatite crystals, and when the fluoride is get released and it is taken by the enamel, so the hydroxyapatite crystals plus fluoride will give rise to the fluoroapatite crystals, which are very difficult to dissolve, and it is giving you the caries is prevented because of the formation of the fluoroapatite, because it is difficult to demineralize. Then the second mechanism, a biological mechanism. Here we will see that there is a formation of the enzyme inhibitor. The fluoride which are present at the surface of the restoration and at the junction of the cement and the tooth junction, there is a formation of enzyme inhibitor, and these inhibitors, they inhibit the carbohydrate metabolism of the bacteria which are present in the plaque, and that's why it prevents the production of the acid, and again this will ultimately prevent the caries formation. So by these two mechanisms, the caries get prevented. The second property is the rheological property. The mixing time is 45 seconds to 1 minute. The setting time is around 3 to 8 minutes. In mechanical property, the compressive strength is high, 200 MPa. Tensile strength is less, 15 MPa. The surface hardness is similar to the dentine, that is 70. No hardness number. It is soluble in the saliva, especially in the acidic condition. Initially, the aesthetic property of this cement is good, but due to the disintegration and solubility occurs faster at the boundaries of the restoration, there is a development of the dark cement line at the tooth cement junction. The micro leakage, the coefficient of thermal expansion is closely matched with the tooth, that is 8 ppm per degree Celsius, and hence it minimizes the micro leakage. This is mainly used in class 3 and class 5 cavities and patients with a high caries index, where the how is the anti-corrogenic property of the cement due to the physiochemical mechanism by formation of the fluoroapatite crystals, which are difficult to get, which prevent the enamel demineralization. And second was by forming the enzyme inhibitors, which prevent the carbohydrate metabolism, and ultimately the caries formation is prevented. Intermediate restoration, because it is having a good compressive strength. It is contraindicated in the posterior restorations and the stress bearing areas. In mouth breathers and dry mouth, the restoration becomes dry, and because of this, it looks very powdery and opaque. That's why it is not used in mouth breathers and dry mouth patients. So, what are the advantages of this cement? It is a good initial aesthetic, anti-corrogenic property, good compressive strength. The disadvantages property are it is highly acidic. It bonds with the tooth with the mechanical bonding. No chemical bonding is there. Color changes over a period of time, as well just in how the dark line appears in between the tooth and the restoration junction. So these are all about advantages and disadvantages of the silicate cement. The silicate cement is a tooth-colored cement with a very low pH. So the applications are restricted in spite of its good strength and anti-corrogenic property. And nowadays it is rarely used because of the introduction of newer and better materials like glass enamel cement and the composite resin. So the expected question can be asked on is, that is the write-in details about the composition, role of ingredients, setting reaction, and factors affecting the setting of silicate cement. And the short answer question, properties of silicate cement, advantages and disadvantages of silicate cement. Mostly I have seen MCQs asked on the silicate cement, like the patient who are having a high caries index, which the cement is used. Then first fluoride containing cement, that is a silicate cement, and where it is contraindicated, that is mouth breathers patient or a dry mouth patient. Then use of agate spatula. Why not using the contraindication of the stainless steel spatula use? Then the anti-corrogenic property by the two mechanisms. So such type of the MCQs can be asked. I have seen very less SAQs and short answer questions because this cement is rarely used, but you should know this cement because the examiner can ask anything on the chapter of the silicate cement. So this is all about the silicate cement. Thank you so much.